Thank you for staying. On now to our first story. And the ranking member on Parliament's Health Committee, Kwabena Minta Kando, wants ambulance personnel whose actions allegedly led to the death of the mother of a newborn, Augustina Awatwe, interdicted. Doctors at the Holy Child Catholic Hospital in Fijai in the Western region had referred Augustina to the Kolebu Teaching Hospital after she developed complications following a cesarean section. However, her husband, John Obriyabwa, said her journey to the hospital didn't materialize because the ambulance driver transporting his wife was delayed because he couldn't afford the 600 Ghana cedis demanded for the purchase of fuel. Let's listen to her husband's story.
Then they will do the surgery on Tuesday. Fine. I prepared everything. We went on Monday, provided everything, and the surgery carried on that particular Tuesday. Meanwhile, she had already called a sister, Doris, to come down to assess. So that is, I left the place. I came home. I was there around 3:30 that way that I got a call from the sister that the people were saying that my wife's condition was critical. Hence, she was being taken to Kolebu. Now, a few minutes later, I also had a call from the national ambulance. It was an unknown number. When the call came, I replied, I said, okay, they have almost reached Impension. They were doing coming. So that I should meet them. I should meet them at Shama Junction. So I joined the van. On the way, we reached to Asokwe Saman. It was there that man behind me, that man who was sitting behind me, not the driver. The driver was Adade. So I will mention him. The driver was Adade, according to the say. Then that man asked, oh, there wasn't any fuel in the van. So I should give them 600. So when you call, what is in the diagnosis? So I'm a teacher, a senior teacher who has taught for 21 years. You will let carry one. If you carry one, when I get to a car, I'm like I'll be able to mobilize something simple. The man said no. So that confrontation went on for some time. There were some women who were there. I even left from the car, the front. They down there, they took 50 cedis with the idea of buying fuel. I thought they would buy the fuel, then the journey continued. The board of fear, I didn't know, maybe whether there was any communication. I was just a free-born citizen on that day. They thought I was dead. I didn't show my dignity as a senior man. So the board of fear, they said, okay, we are driving back to Fijai Hospital. Madam, we were traveling back to Fijai Hospital. So we drove back to Fijai Hospital where my wife's surgery was done. There was a bone of contention between the hospital. Meanwhile, my wife was in the ambulance. My wife was in the ambulance. Yeah, it was after 5 to 6. Remember when they came to me, when they asked me to meet them at that place, it was almost 4 o'clock. So we stood at Asoku Esaman for some time, came back to Fijai Hospital, where their body was laid down.
Well, after hearing his story, minority members on Parliament's Health Committee want the ambulance personnel interdicted pending investigations. They also want the health sector to correct such anomalies. Minta Kando is ranking member.
We would never leave this matter to rest. We will pursue this matter to its logical conclusion. So far, we have listened to the family, we have listened to the facility that did the referral, and there are more questions than answers that have been provided so far. And so, for me, even at this hour, if the ambulance driver and the crew could be interdicted pending investigation, that will not be bad at all. That will not be bad. If there could be some kind of action before the investigation commences, so that after the investigation, if there is unrated, they can go back to, they can resume their duties, that will not be bad. So I believe strongly that some action must be taken, and if the health minister, the minister responsible for health is listening, and for him not until you prompt him, he will never act. So if he's listening, I think this is the time to act before even Parliament comes in. those people should be on interdiction. If we finish, I mean, we will all die one day, and death is inevitable. If at the end of the investigation it was not to be avoided, then if they are exonerated, they can go back to their...
Well, let's talk vaccinations now, and our laws on vaccine mandates are clear. Those are the words of Dr. Kwame Sapong-Esiedu, a research fellow with the CDD Ghana, who is questioning the basis of a petition by the concerned Ghanaian doctors for government to rescind its decision on mandatory COVID-19 vaccinations. Dr. Sapong is casting doubt on the biomedical scientific basis for the said petition. He is, however, urging government to stick to the existing vaccine mandate under the Public Health Act.
Significant issues with the petition because the Public Health Act has been law in this country since 2012. In that, from clause 20 to 26 talks about vaccine mandates. I am wondering whether you petition the executive without parliament to set aside our laws, or you are petitioning the president not to implement our laws because they are clear. If we want the law to be amended, let's go through the amendment process. Don't let us petition the president. I don't even think, I'm not a lawyer, but I doubt the vehicle they're using in our democratic dispensation is the right vehicle. That for me is another issue.
So they may not even be employing the right mechanisms in terms of getting what they want. Right.
Exactly. And then finally, they are talking about a state in the US where vaccination levels are, where vaccination levels are very high. If you have a population of 100 and 70 are vaccinated, but the herd immunity threshold is, say, 89, because there can be transmission, by and large, the people who get infected will be in the vaccinated population. That doesn't mean vaccines are not working. These are biomedical statistics that we actually look into every single day as part of my day job. So when I see things like this, I really, really struggle. I wish I could deal with this on merit. I don't think we have the time. But I'm really struggling with this petition on a number of key biomedical science points.
So in essence, Kwame, for the sake of time, you subscribe to what the GMA has said. Let's keep on. You subscribe to what Kwame Mameno, the health minister, has said. This is non-negotiable. You must get vaccinated. We have a vaccine mandate. Get vaccinated. That's it. I mean, you subscribe to that.
Yes, and I'll tell you why quickly. So far, 9.3 billion of these vaccines have been administered, which gives a vaccine per capita, if you look at the global population of 7.9 billion, of 1.2, with adverse drug reactions less than 4 in 1 million.
Right.
Anyone give me one drug that has this safety profile, and I'll have a decent conversation with them.
We'll bring you more on this after the break. Stay. Welcome back on Joy News Desk. Let's now follow up on that story we brought you as we have interactions with Dr. Fred Adumaku-Boateng, Director of Health in the Bono East region, and Dr. Kwame Sapong-Esiedu. Both of them were sharing their thoughts earlier this morning on the bit about vaccine boosters for COVID-19.
If you look at us who have gotten the 2 doses, and still having breakthrough infection in Bono East,
right,
I can say that none of the health workers have come down with a severe or critical form of the disease.
Right.
As for Bono East, we are collating data as to who is being infected, health worker across. We can confidently say that none of the health workers have come down with severe or critical disease.
Okay.
Nevertheless, we still have the infection, and you see the disability that comes with the infection.
Right.
Therefore, we can make a point, and you know that we will also have to take care of other people who are maybe the pregnant women, the children. So we have a point in making that at least we should get the boost. But I think the leadership of the service and the Ministry of Health are thinking about as to the way forward in terms of the booster. But
okay.
I think the data for us, we have that. I mean, there's the need for health workers to get booster. Not only that, the security officers and others, because of the nature of work that they do. Right. And mind you, if a health worker gets the infection, looking at the isolation days, if you have about, let's say, 30% or 40% of your workforce sick, and they are supposed to take some days off, you know what will happen, the long-term implications. So these are all the other things that you have to take into consideration in making a point for either people who have to get booster and others.
And we vaccinate for a number of reasons. Key amongst them is to stop mortality. That's the main thing. You don't want people to die. Then the next thing is to stop hospitalization, because if you can block hospitalization, then you don't go through severe disease, critical disease, and death. And if you can do that, then the next thing is to stop infection, and finally to stop transmission. Vaccines cannot do all these things at the same level of efficacy. So if you look at what Fred was saying, you'd realize that the global data is clear. Amongst doubly vaccinated people, risk of mortality is decreased by 97 to 98%.
Right.
Risk of hospitalization is decreased by 95%. Risk of infection is decreased by 67%. And that is where the bone of contention is coming from. I'll go to the boosters. The bone of contention is coming from many, and part of what you asked, Fred, was that those who've had 2 doses are the ones who are driving the infection. It's coming from the fact that why are people who are doubly vaccinated getting infected? The truth of the matter is that globally, if you look at all vaccines, and I'll make analogies here, one of the vaccines that has been widely used is the flu vaccine worldwide.
Right.
After the Spanish flu. Mm-hmm. The ability of that vaccine to prevent transmission is 40 to 45% in some years. But it has been in use, and we know how much it has benefited humankind from preventing mortality. Mm-hmm. So no one in the southern or western hemisphere gets a flu jab thinking, I am not going to get flu. They get it knowing that if you get flu, you would get it mildly, and your chances of hospitalization and therefore overrunning the health system is reduced, because a part of the whole thing is what Fred was talking about. You are preventing your health system from being overrun in 2 ways, with cases and from the health professional getting ill. That is why the flu vaccine is being used. So if the COVID vaccine has a comparative efficacy against prevention of infection as the flu vaccine, the question I ask myself is, on what basis are we even having the argument that the COVID vaccine should not be in use? Because in actual fact, it has a higher percentage compared with the flu vaccine. That is one thing. Then that brings me to the booster shot. You have a flu vaccine annually. And there are some people who are 80 years who've had a flu vaccine every single year. And that is what has kept them alive, because they've got chronic diseases. People have multiple bypasses. Why? Because you're dealing with a virus, and viruses mutate. So if you look at the flu vaccine, you may have trivalent, which is 3 strains in one vaccine, or quadrivalent, which is 4 strains in one vaccine. That brings me to the COVID vaccine. We are getting mutants. The advantage we've had is that the mutation of this virus has gone through a trajectory where the dominant mutant strain tends to technically wipe out all the other strains, which doesn't normally happen with the flu vaccines. And that's why you have 3 or 4 strains in there. But with the COVID vaccine, when that happens, what it means is that with like the Omicron, you have what we call immune escape, which then means that the previous vaccines that were developed using the previous known strains are not as effective, and therefore you have a booster. But when newer vaccines come on board, which are gleaned based on the strain of concern, which is the Omicron, you realize that the efficacy against preventing transmission and all that is also going to go up.
Let's stay on health. Researchers at the Kwame Nkrumah University of Science and Technology are calling for an increased sensitization on the NHIS mobile premium payment in rural areas. This comes on the back of research which found that those residing in urban areas are more likely to pay the NHIS premium with their mobile phones. JoyNews medical correspondent Dr. Emanuela Echa-Oseitu speaks with the lead scientist in this study, Dr. Joseph Mafo, for Tech Thursday.
I always find it difficult to go there because when I think about the queue every day, I just find an excuse to stay in the house.
All you need is your mobile phone and your NHIS number. Now, dial *929#, select option 2, then select NHIS card, enter your 8-digit membership number, press send, follow the instructions for payment. Easy, right? The mobile renewal services takes away the time-wasting periods and other inconveniences one may face when going to the NHIS district offices for renewal. This study, therefore, sought to answer the question, who uses and what makes them use their mobile phones to pay and renew their NHIS premium. The research found those residing in urban areas, that is, the Kumasi metropolis, more likely to pay the NHIS premium with the mobile phone.
At the end of the research, we found out that a lot of people were ready to embrace the technology that's paying NHIS premium with mobile phone. So, and we realized that looking at the socioeconomic status of those in the informal sector, we thought it wise that then if such a system is to be implemented and the main tool for implementing this system is mobile phone, then mobile phone should be made affordable so that the ordinary member in the informal sector of the economy can afford it and use it to pay the NHIS premium.
Yes, in the study we found that the urban dwellers are more likely to pay by mobile phone when it comes to paying premium, national health insurance premium. So basically that's what we found, that urban dwellers are more likely to pay national health insurance premium through mobile phones than those living in the rural areas. The reason being that the offices of the NHIS are more overcrowded in the urban areas than in rural areas. So if such a system whereby it will reduce these numbers that go to the offices of the NHIS in the urban areas to pay or register with their national health insurance.
Reporting for JoyNews, I am Dr. Emanuela Echa-Oseitu.
Now, the Ghana Water Company is attributing the erratic supply of water to homes lately to the onset of the dry season. In a statement issued to the general public, the company, however, assures us of being on top of the challenge and fixing the problem. It is thus encouraging the public to adopt various measures in saving water so they do not run out entirely. Director of Communications at the Ghana Water Company, Stanley Marty, joins us live on Zoom for details of the measures being proposed for the public to adopt. Mr. Marty, good morning. Thank you for joining us. If you could unmute, Mr. Marty, so we can hear you.
Yes, good morning and thanks for having me.
It's a pleasure. First off, tell us about these peculiar challenges that have come about as a result of the dry season. What are those challenges?
Okay, thank you very much. You appreciate the fact that during the dry season, we have most of our river bodies evaporating, so that the levels go very low. And that is what we are experiencing currently. Now, apart from the fact that the river sources are going low, we also have serious pollution of the little water in the system, thereby making the water extremely turbid. And as a result, we are unable to abstract enough to treat. Even with the little that we are able to abstract, we have had to dislodge about 30 to 40% of the abstracted water. We just have to dislodge them because they are so turbid and they have to go waste. So we are unable to treat enough for the consuming public, and that's the challenge that we are facing currently.
So speaking about the turbidity of the water, does that have to do with some other activities that we know of, for example, mining? Does it have anything to do with that?
Yes, it's one of the main challenges that we are currently facing. What happens is that when the raw water levels are low, that is when they are also able to operate. So now we realize that they are in full operation and turbidity has gone high. So then we are unable to, the water is so turbid that we are unable to abstract enough for treatment. So apart from that, there are all forms of pollution like discharging or dislodging effluent into our river bodies, and farming activities affecting the river bodies, fish farming, sand winning activities in some areas within the countries are all polluting our river bodies. For instance, in Tamale now, there's serious winning of sand, alluvial sand in the Nawuni River, which we have started for treatment for Tamale. So you've had that challenge in Tamale now. In the Black Water in Upper West region, Galamsey is ongoing. In the Pra in the Western region and in the Central region, Galamsey is seriously ongoing currently and is affecting the quality of the raw water. As a result, we are unable to abstract enough. And then the little that we are able to abstract, we still have to lose about 30 to 40% because of the turbidity.
What precisely would you say your expectation is as a company from the public during these times? What are you looking forward to Ghanaians doing to help you?
Yeah, we expect everybody to be part of the solution, such that we all have roles to play. All have roles to play in the usage of the water in the system. We all have a role to play in stopping the persistent pollution of our river bodies. And now, currently around this season, that is the core of the issue, such that because of the pollution of the river bodies, we are unable to abstract enough.
Right.
Okay. Now, if we do not stop the pollution, okay, some of our rivers will go extinct, and then in the near future, we may not even have the water to abstract to treat at all. And we have had this experience before in times past. I just pray that it doesn't happen. It doesn't happen again. So we all have to get up our loins. We all have to get on board in the education of the general public, so that we stop the pollution of our river bodies. Because around the dry season is the main challenge that we face.
Just to push this further, how bad is the situation such that, like you're suggesting, how close are we to the point where if we don't take this seriously, we might have to do what you're talking about? You'll even run out of water to abstract. How close are we to that? Just so we paint the picture of the seriousness of the situation.
Okay, so let me be very sincere. We are very, very, very close, because we are unable to abstract water from one of our treatment plants, that is the Dabwase treatment plant. So we have had to resort to another treatment plant at Busumase, so that we could abstract very little to treat and pump to secondary Takrady, because that treatment plant serves secondary and Takrady. So if we can't abstract water from Dabwase and we have to resort to our booster station or our treatment plant at Busumase, then it's a very serious problem. Now, on the same Pra River at Seshaheman, where we abstract water for the people of the central region, we are facing that same challenge. The levels are low, the water is so turbid that we only abstract mud. And I don't see how we can treat or abstract water from mud to treat for the people. Okay, so it is a very serious situation, and we are facing the same challenge in the upper west region with the Black Water, because it is so turbid, only abstract stones and sand, and these affect our pumps. It could break down our pumps. If the pumps get broken down, then it means that we may have to wait until we have a new pump, which becomes another challenge. Okay, so the downtimes affect us the pumps also affect us, and then the raw water quality is the most serious situation as I speak. So it's a very terrible situation, and it's happening throughout the country. If you get to Tamale, they are winning sand in the Nawuni River, so they make the water so turbid. The sand, as they dig the alluvial soil, it mixes up, some mixes up with the water, and so we have sand particles and stone particles in the water, and then our pumps, abstract or siphon the water, and then it only siphons sand and then stones, and these affect the pumps because the pumps are not built to separate stones from water or sand from water.
Right.
So it mixes up, it goes into the swamp, fills it up, and becomes another challenge. So it's happening almost throughout the country, and so it's a serious situation which we need to address. And we all have a role to play. The media has a role to play, and as individuals, we have roles to play because we all have relations with people who are involved in these activities. So it's important that we even talk to them one-on-one as relations. That look, you can't think of your pocket alone for it to affect the entire nation. So you need to put an end to it. So you need to appeal to our relations who are involved in these activities so that they put an end to it.
And as a media entity, that is why we're doing this. But I just want to find out right before you take...
And we appreciate that very much.
Yeah, and I want to find out right before you take leave of us. The fact, I mean, it goes without saying from what you've said that your equipment is also being affected even in treating the water. And you talk about abstraction and the difficulty in the process and how all these water sources are running dry. Is that going to affect billing in any way moving forward?
We bill according to the consumption of our customers. So it's only on the volumes that you consume. So, and we measure that according to, we use our measuring instrument is the meter. So that whatever is happening cannot affect your bill in any way. It can only affect your consumption because you wouldn't be getting enough water like you get all the time. You understand?
Right.
Now, the other aspect is that we are using a lot of chemicals now than before because of the high turbidity of the water. So the more we use chemicals, the more production becomes expensive. The cost of production goes very high.
Right.
And so then it will impact on our reports to PULC. So the wisdom of the PULC, if they see our expenditure and in our operations and everything, and they decide that, look, tariffs will have to go high, then Ghanaians will have to pay for it. And that is when it will affect our bills. But currently, we haven't had any increment in tariff. So it is just about our consumption. And I think that most Ghanaians are more concerned about the volumes of water they get in a day than the monies that they have to pay for it. Right. So let us all work things out so that at least we can have enough water in our system to keep healthy and then be productive for the economy of our nation.
Mr. Mate, thank you very much. Mr. Mate, Stanley Mate is Director of Communications with the Ghana Water Company Limited. Now, a Cape Coast High Court has thrown out the case of 23 Assembly members who are seeking to annul the approval and confirmation of the Metropolitan Chief Executive for Cape Coast, Ernest Arthur. Presiding Judge, His Lordship Justice Kwesi Boakye, held that the case of the 23 Assembly members was without legal basis since it was premised on a repealed and non-existent law. Richard Kwejunyako was in court and filed this report.
It would be recalled that on 3rd November 2021, one Godfred Abraham and 22 others, the petitioners, caused an action to be instituted against the MCE for Cape Coast, Ernest Arthur and 2 others. In the said action, the petitioners, who described themselves as current elected members representing some of the electoral areas in Cape Coast, claimed in a declaration that the approval and confirmation of the MCE for Cape Coast, the conduct of the MCE, the presiding officer and the Electoral Commission were in material breach of Article 243 of the 1992 Constitution and the Representation of People Law 1992 PNDC Law 285 as amended and Section 21 of the Local Government Act 1993. They were seeking annulment in the said election to confirm the renomination of the MCE, Ernest Arthur. 2 issues were up for determination in court on Wednesday. The first was on the request of the respondent for their names to be struck out of the petition. On that, the court disagreed with the second and third respondents to the extent that they say the petitioners have improperly joined them. On a substantive matter, the court held that the petitioner's application was incompetent and incurably bad, as it was based on a repealed law. Justice Kwesi Boakye indicated that once an enactment ceases to have effect, as a general rule, all other things that derive some powers or authority from that repealed enactment would effectively be extinguished. Justice Kwesi Boakye considered the error committed by the petitioners as a fundamental one which goes to the root of the petition and disagreed with them when they argued that it was a mere irregularity or a typographical error. He threw out the case and awarded a cost against the petitioners. The court assessed cost at 5,000 Ghana cedis in favor of each respondent and against the petitioners. Reporting for Joy News, Richard Kwejonya-Akon, Cape Coast.
Let's go now to Ho, where the Municipal Assembly opening up the city has been demolishing houses on demarcated roads. And the Ho Municipal Assembly, under the leadership of Chief Executive Divine Bossong, has begun an exercise to open up the municipal capital and ensure an easy flow of traffic. The Assembly has commenced the demolition of houses constructed in areas demarcated for roads in about 4 suburbs in the municipal capital, Ho, to pave way for the construction of roads. There is more in this report.
These ones, these buildings, we are taking it.
The demolition exercise began in the Dokpokope community of the Volta regional capital of Ho. Houses that had road markings on them since 2007 were pulled down to make way for the construction of an access road that connects the School of Hygiene to the Ho Aflau Road. The access road would measure about 100 feet wide. The MCE, Divine Bossong, underscored the importance of an access road to the area which is fast developing.
We have a major national asset here, a government school of hygiene. We have a whole community here, and the place needs to be open. Yes, Rome cannot be built in one day, and Assembly cannot just come today by pulling down the structures and start constructing first-class road. We will go back onto the drawing board, make budgetary allocation for it, plan with my planning department and the whole management of the Assembly, and we'll fix it. We are in to fix, and that's what we are doing.
The demolition exercise would affect about 10 households. The affected residents argued that their grandfathers had settled here in Dokpokope since 1964, hence it has become their home. They have therefore appealed for resettlement since they have no means of reconstructing their households due to impoverished lifestyles.
Have you government va place here va do school? I can't vote do ya va to kremia go vote. Nemia no ya we mia vote na mia. Enwa e fo enwa. Be me va gbe ko friko mi ajo. Mia no ya me. Fika mia no. E fo enyo na wa. E fo me kuma lo bia enwa. Enyo na wa. Ya va gbe ko mi ajo mi have see the autonomy o. Ka ke ekulilo yo.
The demolition exercise was also done at Toviaji to connect Adehenu Street to the Dome Market Road. A new road has also been opened behind the Ho Sports Stadium to connect Living Spring to the Miracle Life Clinic Road. Major work is being undertaken to open up the Atachi Street to serve as a bypass and connect the Some Down Main Road. Over 5 structures are earmarked to be demolished during the exercise. The whole MCE, Mr. Bossong, said the Assembly would engage the affected residents and map out a resettlement plan for them.
That is another case. If there is anything, they should come to the table. I am always ready. As you can see, the community was ready before we even came.
However, road users and residents have lauded the initiative and hoped it would be extended to other parts of the municipality. Fred Kwame Asari, Joy News, Ho.
Well, from the demolition exercise in Ho, we take a break. When we come back, we bring you business. Stay.
Hi, good morning. Welcome to Business. My name is Darryl Kwao. The World Bank is forecasting a 5.5% expansion of Ghana's economy this year. That's according to its January 2022 Global Economic Prospects Report. The projected growth rate is lower than the International Monetary Fund's projection of 6.2%. It is, however, higher than Sub-Saharan Africa's average of 3.6%. Charles Nixon takes us through the report.
Ghana will certainly become one of the fastest growing economies in Sub-Saharan Africa based on the forecast by the World Bank. The report said elevated commodity prices are projected to both support recovery in extractive sectors and boost export and fiscal revenues. This will help ease some pandemic-induced fiscal pressures and external financing needs. It, however, pointed out that many Sub-Saharan Africa countries, including Ghana and Rwanda, witnessed a marked deterioration in fiscal balances because of deployed relief measures, depleting already narrow fiscal space. This, together with constraints on financing and pressures to improve debt sustainability, will lead to a much less supportive fiscal stance across the region over the forecast horizon. The World Bank also forecast a growth rate of 5% for Ghana in 2023, but maintained the 4.1% rate for last year. The economy expanded by 6.6% in the third quarter of 2021. Education, health and social works, information and communication, as well as hotel and restaurants drove the growth rate.
Prices of petroleum products are expected to go up beginning this weekend. This is based on new price lists of bulk distribution companies for the next 2 weeks, cited by Joy Business. George Raffi has more.
The data showed that a litre of diesel should be going up by 4.78%, while a litre of petrol should be increased by 5.21%. This should translate into 32 pesos increase for diesel. When it comes to petrol, we should be doing about 35 pesos per litre. This is the price that the bulk oil distribution companies are willing to sell to the oil marketing companies from this Sunday, January 16. This should mean that these retail companies may have little choice than to pass it on to consumers from next Monday, as some have argued that looking at the current challenges facing them, it might be difficult to absorb the expected adjustment going forward. The increase has been influenced by rising prices of crude oil on the international market due to the fact that these traders think that the Omicron variant may no longer pose a major threat to demand for their product as more economies are now opening up. Well, at the end of the day, many will be looking forward to see what the three major oil marketing firms, that is Shell, Total and Go, will be doing when it comes to their margin of increase, a move that would influence the over 100 oil marketing companies in the country when it comes to their pricing. But some have argued that since the Ghana cedi is still depreciating against the US dollar and crude oil expected to increase further in the coming days, well, consumers may have to brace themselves for more hikes in the coming weeks.
Now, as government works to deal with the unemployment situation, it is devoting this year to building entrepreneurs. One of the things, if you're considering entrepreneurship, that would make your business stand out is branding. Impressions do count. Well, branding strategist Bernard Kelvin Clive shares some tips.
The thing is that it said that even if you're on the right path and you don't keep on pushing, you'll be run over. So in this very competitive world now with social media and all this stuff, if you think you've arrived, you rot. So the thing is that if you arrived, you rot. If you are green, you grow. So constantly, you need to keep on putting your brand in the face of people so that you become the go-to person. So when you thought of maybe branding, entrepreneurship, business, maybe you might think of Echo. When you think of something, the name comes in mind. But if you start losing that hold, brand, you're losing business. So I ask people simple questions. Why does Coca-Cola still keep advertising? You have all the money in the world and all that. If you lose your ground then there's a product at the next corner. I tell entrepreneurs that your competitor is just a click away. So constantly, consistently, you need to push out your brand. Let them know the value you can offer. Let them create that perception and hold that in the minds of your audience and the marketer. This is what you stand for. They can patronize you. If not, the next minute, decade, when you're gone, you're wide off. So very critical in this age that you constantly let your brand be known, seen, heard by providing value.
And we have an exciting conversation tonight on Joy Business Social, on mentoring and networking, how to make it work. We'll have Farouk Kailan, who is CEO of Premium Africa Holdings, as our guest tonight. That is across our social media platforms at 6. Don't miss it. That's business. Sports is coming up.
Well, right before we draw the curtains on Joy News Desk, you can check out more stories on myjoyonline.com, and some of them this hour. AFCON 2021, Burkina Faso captain Bertrand Traoré out with the coronavirus, that is COVID-19. AFCON Day 4, referee controversy in Tunisia, Mali game as Gambia make history. Of course, Zambian referee there. Then there's also Kudus Mohammed returns to Ghana camp this week. And Andre Dede Ayew out of Black Stars training as precautionary measure. There's also, if you scroll just a little lower, I think we'll do that story, AFCON 2021, and it's still anybody's game. The Black Stars can still make it. That story and more on myjoyonline.com. My name is Benjamin Akapo. Thank you for staying.